You see darkness, I see light, see me. You see give up, I see fight, see me. You see an addict in a queue, so easy to look through. But one day it could be you, see me.
So I think stigma around addiction in a healthcare setting can be in the forms of words, actions, how we treat someone. I think it's something that people do when they don't know that they're doing it, and how that can affect someone that's suffering an addiction. You hear comments or words that are used to describe patients. We're taking up a bed, we're not ready to make any change. They've come in to ask for help, and then they're treated with negative words that then impacts them doing that. It can prevent them from taking those first early steps in making changes and starting their recovery, and makes them feel less worthy.
Growing up, I was in domestic violence relationships from a very early age with partners who were in addiction, which introduced me into drugs and alcohol basically. So I was admitted to hospital, and I did that for quite a few years in my life. You know, I was stuck in that cycle, a vicious cycle of using drugs and alcohol as a coping mechanism for things that was happening, and wasn't really getting any further forward. I think it was, for me personally, it was the judgment that I felt like I would receive when I came here. I feel like because of the stigma that comes with addiction and within using substances, I felt like I held back a lot that I should have really told the staff here at the hospital. When I was here, I never had that conversation of why I was here. Was I seeking any support? I didn't have that open conversation with anybody. So I was here and I was being treated and being fixed. But I didn't have a conversation that could have maybe benefited myself when I walked out these doors. That could have maybe changed my life, which I think would have made a big difference.
I actually started off my journey in hospital. So I was admitted into hospital through my alcohol use. I think I was hospitalised about 4 times, and I did overhear people on, I think, my 3rd occasion when I went to A&E, and I heard one of the healthcare workers saying, "Oh, not her again." It makes you feel like you're being judged. It makes you feel like you don't want to accept support from people, and it just makes you feel worthless and not worthy of anything. My ideal experience of coming into hospital and getting that support would have been for somebody to actually sit and listen to us and ask us if I was okay and how they could help us, because I didn't get any of that to start off with. I would have felt like I was being listened to, and I probably would have opened up a lot more, would have made a hell of a difference.
My addiction took hold during lockdown. My turning point was being arrested for drink driving. You know, sitting in a ward and seeing how medical staff interact with other patients that are in with, you know, similar conditions, but that haven't been caused by an addiction. I've witnessed a distinct difference in how the interaction takes place. And sometimes, you know, you just need somebody to sit next to you and say, you know, at the moment we can't give you something, tell us how you're feeling. And that didn't happen. It was, no, you can't have it. End of, gone. It's understanding. You know, not everybody gets into addiction by choice. It's led there by a circumstance of life.
But I think the biggest problem thing is the attitude of healthcare professionals. Do they even ask the question? Do we screen everybody that we should and ask them about their drinking? I know that we don't, not enough, but we should be asking, and by asking then we make it okay for that person to say, yes, I do think my drinking's getting a little bit crazy and I want to do something about it. And I think that's going to be potentially the biggest challenge for our team, is how we get everybody to be more comfortable asking that question. The team came into place in November of last year, and the idea is that people who present at the hospital with either an awareness of their alcohol use or are completely oblivious to their alcohol use being a problem and influencing their physical and mental well-being, our role is to talk to them, support them, guide around alcohol detoxes, and see if there's any other interventions that we can put in place to help them reduce and refer on to services in the community for support if need be. I think it's having an honest conversation, listening to what they're saying, asking them what they want to do, what they think is getting in the way of them making those changes. And rather than challenging that conversation in an argumentative way, just question them and get them to start to think about what they need to change. Nobody chooses to be in this mess. They don't. They might not know how to get themselves out of it. And that's what our role is.
Something that I do in my everyday practice is treat patients how I would want to be treated, or my family or my friends. Those steps and changes, even if they are small, but could be huge to them, to help them in their journey.
The way I approach people now and try and get rid of that stigma is by I have that empathy approach, you know, and I make sure I listen to people.
I think sharing our stories and our journey is a really powerful tool that we use in the community, you know, for motivation to change. You know, within Stigma, society in general looks at addiction. They don't look at the person. You know, we need to remember that behind this addiction we have a person who is a mum, who is a dad, who is a brother, who is a sister, who has a story.
You can't spend all day at somebody's bedside, but just listening and get that knowledge and understand where the person's coming from.
So my hopes for the future for service users, patients, is to hopefully have that courage to be able to come to hospital if they're feeling unwell. They have that courage of feeling like they're not going to be judged, they're not, you know, they're all going to be listened to, and not be frightened.
People need to recognise that I'm not defined by my addiction, I'm actually defined by my recovery.
Recovery is it's a strength, it's a power. You know, it should be empowered, it shouldn't be looked upon or judged, or, you know, it's something that holds you back or defines you. It should be something that's celebrated and something that empowers people to move forward in their life and to be praised for.